The next question is for a patient with ALK-positive lung cancer who has had disease progression on a second-generation ALK inhibitor, such as alectinib or brigatinib, and undergoes a biopsy with NGS testing not showing any ALK mutations or other potentially targetable mutations. What do you think the next treatment should be? Should lorlatinib be tried? This is another very excellent and insightful question. So in the phase 2 trial of lorlatinib that examined the efficacy of lorlatinib in patients, among various cohorts, there were patients who had disease progression on at least one second-generation inhibitor. And there was a planned molecular analysis that looked at correlation between pre-existing ALK resistance mutations and responses to lorlatinib. And there was a clear separation where those patients who had known ALK mutations had significantly higher response rate to lorlatinib and longer progression-free survival as well, compared to those patients who did not have ALK mutations detected in the tumor. However, even looking at the subset of those patients who did not have ALK mutations detected at repeat biopsies after second-gen TKIs, the response rate to lorlatinib in that setting was nearly 30%. It was just under 30%, meaning that there are still patients who do not have ALK resistance mutations that still go on to respond to lorlatinib. So it is an imperfect correlation. And in my mind, that shows us that while the knowledge of ALK mutations being detected gives us some level of confidence in using lorlatinib as the next line option, it doesn't mean that we should exclude lorlatinib as a next line option for our patients who are not found to have ALK mutations. One thing that I will say is that if a repeat biopsy does not show an ALK mutation, that would make me discuss more heavily some of the alternative options as well. In addition to trying lorlatinib in case it does help, we would discuss perhaps these clinical trials where we offer lorlatinib in combination with another agent like a MEK inhibitor or a SHP2 inhibitor, both of which may offer some additional benefit that remains to be seen, or chemotherapy as well. So it does make that discussion more complex. And we will take into account all of the available data that we have in hand at the time.